Good evening. Thanks for joining us on the news on NTA International. We're live in Abuja. I'm Ruth Aguele. Let's start with the headlines. Presidential task force on COVID-19 extends ban on all flights by 4 weeks. Federal government approves 2 months license fee waiver for terrestrial broadcast stations. And Ministry of Environment issues certificate of decontamination to some ministries and agencies of government. NTA and others certify COVID-19 free. We'll begin with the PTF. The Presidential Task Force on COVID-19 has raised concerns over an increasing rate of infection of medical doctors and other health personnel across the country. Chairman of the task force, Boss Mustafa, said the task force will do everything possible to protect frontline workers against contracting the disease. Minister of Health said professionals would be sent to Sokoto and Katsina states to train health workers and assist the governors in slowing the spread of coronavirus. He said organized ambulance service is already in operation in Kano State to assist with response, especially at odd hours.
Support the mental well-being of our compatriots that are infected.
The reported cases of infection in Kano are a case in point, showing the urgent need for intensifying training, particularly among healthcare workers.
The task force also announced that the ban on all flights in the country have been extended for another 4 weeks.
And I urge members of the Broadcasting Organization of Nigeria to take advantage of this committee to come up with measures to mitigate the effects of the pandemic on the entire industry. The issue of journalists being prevented from doing their work in Lagos, I will take up the matter with the Commissioner of Police in Lagos, because my understanding, and I think it has worked so far, is that anybody with a valid identification as a journalist is allowed to move about unmolested.
Let's take you to the global scene. United Nations says persons living with disabilities are among the worst hit by COVID-19 as students return to schools in Wuhan, origin of the virus. Let's join Joyce Ametu for an update.
At 11:40 p.m. May 5, 2020, the Nigeria Center for Disease Control and CDC said there are 148 new confirmed cases of COVID-19 in Nigeria, which brings the total number of cases in the country to 2,950, out of which 481 have been discharged, while 98 deaths have been recorded. Top on the cases chart is Lagos, with a cumulative total of 1,226, followed by Kano, 397, FCT, 307, Borno, 106, and Gombe, 98. Below the chart, we have Niger with 4 cases, while Benue, Imo, and Abia have 2 cases each, and Anambra with 1 case. In Africa, a tally by Worldometer as at 6 p.m. reveals that the continent has 51,066 infections with 1,928 deaths, as recovered cases stand at 17,222. Meanwhile, figures published by Johns Hopkins University as at 6 p.m. show that 3,765,648 cases have been detected worldwide, with 260,377 deaths and 1,268,657 people have now recovered. Secretary General of the United Nations, Antonio Guterres, said the world's 1 billion persons living with disabilities are among the hardest hit by the coronavirus and called for them to have an equal access to prevention and treatment of COVID-19. In the meantime, U.S. President Donald Trump is winding down the task force leading the country's coronavirus response, even as data shows 72,449 Americans have died from COVID-19 and 1,240,411 have been diagnosed with the disease. And a report from Chinese city of Wuhan, where the pandemic began, says schools opened for the first time after being closed for more than 3 months. A sign that the city and surrounding Hubei province are slowly coming back to life. And that's a global update on COVID-19. Thanks for watching. I am Joyce Ometu.
Thanks, Joyce. And news on the foreign scenes indicate that one of the stranded Nigerian travelers returning from Dubai, that is United Arab Emirates, Mrs. Kafaya Tamusan, has been delivered of a baby boy on board. Emirates airline departing to Lagos, she put to bed on board in the plane 30 minutes after departure, which resulted in the plane returning back to Dubai after takeoff. A statement by the chairman, CEO, Nigerians and Diaspora Commission, Honorable Abike Dabiri Arewa, said she's currently on admission at a hospital in Dubai. She said the Nigerian ambassador in Dubai, Ambassador Rimi, and staff of the embassy are in touch with mother and child who are in good condition, adding that Emirates Airline had to change to another aircraft, which is now en route to Lagos with 265 returnees on board. Abike Dabiri Arewa said she will return to Nigeria after obtaining birth certificate and all the necessary travel documents for her baby boy. And from a new baby to the old, elderly persons in Ekiti State have resorted to physical exercises and prescribed nutrition to cope with the challenges posed to their immunity by COVID-19 related symptoms. Yemi Dalemo reports that apart from hindered access to health facilities arising from the lockdown, the elders are having issues with medication, as 3 persons have reportedly died as a result of this.
Meet Pa Isaiah Rotimi. He is an 82-year-old retired police officer. We came early enough to meet him doing his early morning physical exercises round his compound in Temidire community in Akure. Pa Isaiah Rotimi says regular physical exercises have become his main strategy to stay healthy and alive in this era of COVID-19.
If I want to take my food early in the morning, I will take banana, apple, vegetable.
These are very challenging times for the elderly, as the Africa Centers for Disease Control and Prevention says 8 out of 10 deaths reported globally are adults 65 years old and above. The WHO even puts it in greater perspective when it revealed that older people and those with pre-existing medical conditions such as asthma, diabetes, heart and lung diseases are more vulnerable. While the health institutions are open to all categories of people in Ondo State, the challenge faced by the elderly most times is mobility, especially in this period of lockdown. But many of them still find their way to their healthcare providers.
Well, I had to go to somewhere yesterday just for a medical checkup somehow, private hospital. I was attended to very well.
But one thing that we noticed is that the elderly seem to be more compliant to the various government directives on social distancing, hand washing and use of face mask. From Akure, Olajide Bello, NTA News.
We apologize for that mix-up there. It's actually by Olajide Bello and not Yemi. But joining us in the studio to look at the issue of impact of COVID-19 on the elderly is the Chief Executive Officer of Dave Omakaro Foundation, a foundation that deals with the elderly. Thank you very much for joining us.
Thank you very much.
All right, when we say the aged, which categories of persons are we referring to?
Older persons, we refer to persons 60 years and above. That's the United Nations categorization of older persons. And of course, from global data, we have confirmed that mortality rate is very overwhelming among the geriatric population. And when we talk about the geriatric population, it's always good to put a face to it. These are our fathers and mothers, our grandmothers, our grandfathers. These are the retired public servants. These are the subsistence farmers in the rural areas. These are people we love. So their lives are really not expendable. Nobody's life is expendable. Before now, you know that older persons were really marginalized. They were practically invisible, voiceless. And when you talk about life expectancy after 60 was for the female 17 years, and then for the male 15 years. So now COVID-19 has come, and the brutality with which the disease, affects the geriatric population is just telling us that the lifespan of older persons is being cut. So we have to do everything that we can to ensure that the containment and the mitigation strategies really protect these vulnerable ones. Okay, and which brings us to COVID-19. We know they're mostly hit by this virus. From your perspective, why do you think this is so? We know that even researchers have told us that 77% of persons 60 years and above have some one or two underlying medical conditions. So they have comorbidities, and because of that, they are more severely affected. And of course, you will know that non-communicable diseases disproportionately affects older persons. And unfortunately, resources have not really been put into, treating non-communicable diseases. So I believe that the lessons that COVID-19 has taught us is that after now, post-COVID-19, a lot of attention is going to be paid to the vulnerable population, older persons, their access to health, access to nutrition, and of course, social protection. And talking about really shown the vulnerability. Okay, and talking about social protection, earlier you stated that part of these issues affecting them is as a result of past neglect. So looking at the future now, how do we ensure safety and social well-being of these elderly people? I want to believe that after now, especially now that Nigerian government is coming up with a sustainability plan, having finished with the economic growth and recovery plan, I want to believe that now we are going to pay attention to inclusion, persons that hitherto were left behind. Now, if you notice the social investment program of the federal government, paid attention to unconditional cash transfers to households, poor households. And I want to say here, and I say here again, that excludes older persons. Most older persons do not really belong into households. You find them, they live with minors. And then research has shown that only 2% of older persons benefit from unconditional cash transfers to households. And then, of course, even within the households, if they are there, the money, we assume that the money is divided equally. We assume that older persons will be part of the decision making, which is not always so. 1 in 6 older persons are abused. They suffer violence even within the family. So I think that what government should do is to, have old age grants, a category of social protection dedicated to older persons. They could upscale it. If you're not going to give to 60 years and above, you could take it to 75 years and above and let them be means tested. All right. So that you know that the really poor, the multidimensionally poor older persons who are in the rural areas and the remote places can have access to social protection. Also health coverage. All right. Health coverage. Thank you very much. I'm afraid that's where we'll leave it. Thank you very much, Mrs. M.M. Omar-Karo. And I'm sure from our own end, we should also endeavor to look out for the elderly. Thank you. All right, let's look at more issues. The federal government has approved a 2-month license fee waiver for terrestrial broadcast stations in the country. Information and Culture Minister Lai Mohammed announced this at a meeting with members of the Broadcasting Organizations of Nigeria in Abuja. Let's hear from Anthony Forson.
The waiver, as approved by the federal government, the Information and Culture Minister said, is part of initiatives to serve as palliatives to cushion the effects of the hardship bond members are going through in the face of the current pandemic.
I make bold to say that while bond members have been hit very hard by the effects of the current pandemic, they are not alone. In fact, the entire creative industry, which also covers the broadcast industry, has been affected by the pandemic and has inflicted extensive damage on the economy of nations across the world.
To this end, the minister explained that a committee has been set up to look into the situation and advise government appropriately on the best way to mitigate the effects of the pandemic on the industry.
Therefore, there's no doubt that we need a collective and government-supported approach in dealing with the immediate short and long-term palliative and initiatives for the industry in order to mitigate the effect of the pandemic on the sector.
Vice Chairman Broadcasting Organizations of Nigeria, Godfrey Ohuabunwa, explained that the impact of COVID-19 pandemic has greatly affected the economy and way of life, creating platforms for nations to review their survival strategies.
While we appreciate the efforts of government in tackling the pandemic, we urge for government intervention so as to save the sector from imminent collapse arising from declining revenue.
Bond, however, used the opportunity to commend the Nigerian Center for Disease Control and all frontline workers in the fight against the pandemic. In Abuja, Anthony Forson, NTA News.
And a break is next for us, so please stay tuned.
Action. Make your home the place to be with GoTV's super cool kids channels.
That sounds fun.
From funky friends that'll keep even the little ones busy.
All right, everybody, let's do this!
To learn as you watch educational shows for curious young minds.
You can do some amazing things.
There's plenty for everyone. Tune in to our kids shows and get everything you need to keep the kids entertained and learning the fun way. GoTV, live it, love it.
This is to say a big thank you to all the healthcare workers who put their lives on the line, working in all the 36 states of the Federal Republic of Nigeria, especially Lagos, Kano, Ogun, and Abuja, to ensure that we beat COVID-19 in the least possible time. Thank you so much. You are our superheroes. This message is from the Governor's Wife Forum, the wife of the Vice President and the First Lady of the Federal Republic of Nigeria.
Thanks for staying tuned. After the initial disinfection of public places, the Federal Ministry of Environment has issued certificate of decontamination to some ministries and agencies of government, as well as private organizations in the Federal Capital Territory. Onenge Fine Affairs reports that the certification requires sustenance of health, social distancing and other protocols to prevent contamination of the certified locations.
COVID-19 has no cure, but the virus can be prevented. To keep the virus away, the federal government flagged off decontamination of public places in April 2020. Over 200 high-risk areas, including work environments, markets, motor parks and roads, were disinfected. The Nigerian Television Authority, NTA headquarters, is among agencies covered in the first phase of the exercise and one of several public and private organizations receiving certificates of decontamination from the Ministry of Environment.
They have to continue to observe all these measures, the washing of hands, the social distancing and everything else, and keeping track of people that will be visiting that premises, and also keeping track of anybody that may exhibit symptoms of COVID-19 within that premises.
Certification by the ministry also comes with additional responsibility to maintain preventive protocols to forestall COVID-19 infections in affected premises.
COVID-19 has no cure. The only cure against COVID-19 is to make sure that you stay uninfected. We must all observe personal hygiene, right? We must keep to the social distancing advisory, right? We must avoid crowded environments. It is the responsibility of each and every single Nigerian to make sure that the war against COVID-19 is successfully executed.
50 premises have already been covered in the second phase, while collaborations are on to decontaminate airports and airplanes, as well as schools across the country. In Abuja, Onengiye, Fine Face, NTA News.
While efforts have been intensified on another hand, some Nigerians have continued to disobey orders and defy precautionary measures against COVID-19 as the total lockdown is eased. Adebola Brookslyn Sunday has the details.
Its third day of the partial lockdown and overnight curfew announced by the federal government. The roads are free for both pedestrians and motorists, but some Nigerians have refused to adhere strictly to the guidelines that accompany the ease. To curtail the spread of COVID-19, the government also announced the compulsory wearing of face masks, which created an opportunity for business-minded Nigerians to make bricks business. Shop owners around the popular UTC printing complex were seen trying to force themselves into one of the plazas, not minding the physical distancing rule.
We feel we should go back to job to start earning our normal daily income.
If this pandemic spread now, I want to work, I want to do my job, won't be there again. So we need to safeguard our lives first.
We shouldn't wait for us to begin to experience that kind of huge number of deaths before we begin to observe the rules that are given to us now.
The limit of passengers in vehicles might have affected the rates of income for commercial drivers. Isiaka Baba said they can't wait for situation to return to normal.
I carry 100 naira, but now it's 150 bites. That's 3. That's 450. So before you carry 600.
2 people at the back seat of the car. I think it's a way to control the spread.
I also visited one of the mobile courts located around the Galadimawa roundabouts set up for Faforiji Adeyegba is one of those who flouted the order on restriction of movements. In his judgment, Senior Magistrate Musa Abdulrazak Eneye said the people have breached the curfew order under the Quarantine Act 2004.
Careful. As I bought the fuel finish, on the way coming, I reached Galadima roundabout. Police arrested me there. I'm very, very happy for the judgment they are judging.
Medical experts say the ease on the lockdown does not translate into return to normal way of life before the pandemic. Adebola Brookslyn Sunday, NTA News.
Society Committee on COVID-19 has begun a process of engaging with Nigeria's Correctional Service to support the congestion of prisons to curb the spread of coronavirus. Correspondent Obiageli Ogwoke reports that the move is part of the committee's prisons outreach and community sensitization on coronavirus in Abuja.
Congestion constitutes a major problem on the welfare of the inmates in the Nigeria prisons. With the outbreak of coronavirus, fears of outrageous spread among inmates has continued to increase. In line with presidential order on prison decongestion, Society Committee on COVID-19 embarked on bailout and family reunion in Suleja.
We decided also as the first private organization to complement Mr. President's directives and effort of government in decongesting the prison. So today we are here to pay for fines of some prisoners.
Under the project, some inmates were bailed with their charges cleared.
Inmates were happy, and also the relations to the inmates were highly excited that during this COVID-19 period, the government has extended, or the society has extended this gesture to them.
We have seen female pregnant inmates, we have seen the ones with children, we have seen the ones who are vulnerable, they are sick. The directive from Mr. President that the prisoners should be released. We are seeking for gender equity on that list for the release.
Safety materials and medical care were also provided. Society Committee Against COVID-19 has established a broader platform, bringing together civil societies, non-governmental and religious organizations to work towards taking coronavirus campaign to the smallest units of Nigerian communities. Obiageli Ugoke, NTA News.
President Muhammad Buhari has sent his goodwill and prayers to the Emir of Daura, Alhaji Umar Farouk Umar, after he was admitted to the Federal Medical Center, Katsina State. President Buhari, who holds the traditional title of Bayajida Daura, his hometown, says he received the news of the Emir's sudden illness with concern and expressed best wishes for the speedy recovery of the monarch. In a statement by Garba Shehu, Senior Special Assistant to the President on Media and Publicity, President Buhari expressed satisfaction with the reported progress and recovery of the Emir since his hospitalization. In other news, pursuant to the Nigeria Police Trust Fund Establishment Act 2019, President Muhammad Buhari has approved the appointment of retired Inspector General of Police Suleiman Abba, CFR MNI, as Chairman Board of Trustees of the Nigeria Police Trust Fund. In a statement signed by Senior Special Assistant to the President of Media and Publicity, Garba Shehu, the President also approved the appointments of Ahmed Aliyu Sokoto as the Executive Secretary of the Board. The appointments are in furtherance of the Buhari administration's commitment and drive to retooling policing architecture in the country by emplacing the Police Trust Fund to meet the aspiration of a well-funded, equipped and highly professional Nigeria police force in line with international best practices. The Minister of Police Affairs, Mohammed Megari Dingyadi, will announce the inauguration date of the Board of Trustees of Police Trust Fund. Let's look at security issues. A total of 343 Boko Haram and Islamic State of West Africa fighters met their Waterloo, while 16 criminal informants kept behind bars after military and other security agencies operations. Security agencies operations, I beg your pardon on that. The coordinator, Defense Media Operations, Major General John Eneche, announced this at a news conference in Abuja. Let's hear from Defense correspondent Ismail Musa.
The periodic news conference provides update on armed forces and other security agencies operations across the country.
Troops of Operation Wellstroke during the period reviewed clamped down on armed militia and other bandits in Benue and Taraba states. Within the period, troops rescued 7 kidnapped victims and recovered large catch of arms.
Apart from the killing of 343 Boko Haram fighters, arrest of 16 informants, a total of 24 kidnapped victims were rescued, while 153 bandits eliminated.
Several bandits' locations and hideouts were cleared with close air support provided for ground troops. A total of 17 kidnapped victims were rescued.
Similarly, several maritime operations were conducted to safeguard the nation's oil assets in the Niger Delta region.
A total of 61 illegal refining sites were discovered during anti-crude oil and anti-illegal bunkering operations in the Niger Delta region.
The Navy also rescued 3 fishermen whose trawler caught fire in the Lagos axis. The Defense Headquarters appealed for regular intelligence report to enhance proactive response to security threats across the country. In Abuja, Ismail Musa, NTA News.
That's it on the news. Thanks for staying with us. I'm Ruth Aguela. Bye.